Hi Sydney, it's good to see you today. My name is Dr. C. I'm going to be taking a look at you today. I see that we are here for a first time visit. Will you go ahead and tell me what brings you in today?
Yeah, it's my right hand.
Your right hand, okay.
It's been feeling a little numb and tingly.
Numb and tingly. When did this problem first occur?
Last night.
Last night. Did you eat anything that you happen to be allergic to? Anything that you hadn't eaten before?
No.
Okay. Did you do anything outside of your normal routine last night?
No.
Okay. Were you laying down, standing up, doing any kind of physical activity when you first noticed this numb, tingling sensation?
I was working out.
Working out. Okay. Was it something that involves the hands at all?
Mm-hmm.
Okay. Have you tried any kind of cold compressions on it? Any ice baths?
I did some ice.
And the pain still persisted?
Mm-hmm.
Gotcha. I'm going to go ahead and just ask you a few generalized questions now. Have you had any history with high blood pressure?
No.
Can you go ahead and confirm your date of birth for me, please?
May 10th, 1998.
Have you been outside of the country in the last 6 months?
No.
Any surgeries within the last year?
No.
Okay, Sydney, I'm going to go ahead and pull up a chair and we're going to take a look at your hands.
Great. Thank you.
Okay, Sydney, first I'm going to begin by lightly palpating the muscles of the hand, feeling the skin for any bumps or lesions. Let me know if this causes you any pain.
It's a little tender.
A little tender? Okay, I'll be gentle. I'm going to feel for any kinds of masses beneath the skin. Do you have full range of motion in your wrist and joints?
Yes.
I'm not feeling any lumps. The skin does feel a bit swollen though, which would explain the tenderness that you mentioned. Does feel swollen. I'm going to go ahead and set this down and take a look at the other hand. Does this hand, is it causing you any kind of pain right now?
No.
I'm also not feeling any kind of lumps or masses. I'm going to gently test the mobility of the wrist and joints. This hand does not feel swollen, unlike our other hands, which is a good sign. Okay, Sydney, now I'm going to go ahead and measure your hands to take note of the sizing of both hands so we can see how much our right hand is swollen. I'm going to have you place your hands on this pillow so it's a little more comfortable for you.
Thank you.
Okay. Yes, the right hand is definitely more swollen. Go ahead and turn both of our hands over here. I'm going to measure the tips of the fingers now. Now I'm going to begin by doing a visual inspection of the hands, making sure there's no cuts or tears to the surface of the skin, making sure there's no kind of abscess or any kind of fungal infection between the folds of the skin. Go ahead and turn your hands over here. I'm not seeing any kind of lesions to the skin, which is a good sign. Even though your left hand isn't bothering you today, it's still good to take a look, make sure there's no underlying issues while you're here. Take a peek underneath our fingernails. Your nails are very clean and well cared for, which is a great sign. Now I'm going to ask for you to turn your palms down. I'm going to use my tuning fork here against the bones in your hands. I want you to close your eyes. And then I'm going to put the tuning fork into your skin. It's going to be vibrating. I'm going to ask for you to tell me when you don't feel it anymore. Can you feel this?
Yes.
Tell me when it stops.
Stopped.
Can you feel this?
Yes.
And let me know when it stops.
Stopped.
Can you feel this?
Mm-hmm. Stopped.
Can you feel this?
Yes. 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 Stopped.
I'm going to go ahead and do your left hand now. Can you feel this?
Yes. Stopped.
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 And 2 more. Can you feel this?
Yes. Stopped.
Can you feel this?
Yes. Stopped.
Now I'm going to go ahead and take a look at the joints by using a tiny bit of acupuncture. Let me know if this is uncomfortable in any way. I'm going to ask you to flip your hands over for me, please. Thank you. Just going to go ahead and massage the muscles a tiny bit. The joints seem to be healthy, which is another good sign. But we are going to continue to take a look at you and help get to the bottom of this. To further assess the joints, I'm going to percuss using my hammer tool. You can continue to relax. Ask you to flip your hand over here. Okay, now you can go ahead and relax this hand. Ask you to flip your hand for me, please. Okay. Your joints seem to be very healthy, which is a good sign. We are going to get to the bottom of this though. I'm going to have you close your eyes, and I'm going to go ahead and rub this sensory brush against one of your hands. I want you to tell me if you feel it on the right hand or the left hand, please.
Left. Right. Left. Right. Right. Left. 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 Right. Left. Right. Right. Left. Left.
I'm going to ask you to flip your hands over for me, please.
Right. Left. Left. Right. Right. Left. Left. Right. left, 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 right, right, left.
Okay, Sydney, I'm going to do a sharp or dull test on both of your hands. This is what sharp is going to feel like, and this is what dull is going to feel like. Can you notice the difference between those two sensations?
Yes. Sharp, sharp, dull, sharp, 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 dull, 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 sharp, dull, sharp, 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 dull, 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 dull,
I'm going to ask you to turn your hands over for me, please.
dull, dull, sharp, dull, sharp, 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 dull, dull, dull.
Okay, Sydney, I did notice a bit of difficulty telling the difference between the two of those on our right hand here, which is an area for concern. We're going to move on to a warm or cold test. Okay, I'm going to press an object into your skin. It's either going to be cold, like this, or warm, like this. Can you tell the difference between those two feelings?
Yes. Warm, cold, warm, warm, cold, cold, warm, 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 cold, 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 warm, 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 cold, warm.
Okay, now we still had a bit of difficulty with this test as well. On our left hand, we got everything accurately, and on the right, we are having a bit of difficulty. We are going to want to do some further testing on you tomorrow, if you're available then. In the meantime, I'm going to go ahead and massage your hand a little bit, as well as prescribe you some medication to ease the pain for you. For now, I'm going to go ahead and massage your hand with some of this eucalyptus massage oil. Go ahead and raise this hand up. I also have this anti-inflammatory cuticle oil that I'm going to apply in a small amount. I noticed that the tips of the fingers were especially swollen, so this is going to help to reduce that inflammation. Okay, Sydney, this should hold you over in the meantime until we can fit you into your appointment tomorrow. I also am going to go ahead and send you a prescription to a medication that will help you ease the pain. How does that sound for the moment?
That sounds great. Thank you, doctor.
My pleasure. We'll see you again tomorrow, Sydney.
Thank you. See you then.
Thank you.